In this video, we will demonstrate exercises and stretches to carry out following your total hip replacement surgery. Once you have been reviewed by your surgeon at 6 weeks and are ready to progress, we recommend the following exercises. Please see a physiotherapist to assist you in progressing to the next stage of your rehabilitation. We suggest you complete the programme up to 4 times per week. We recommend completing each exercise 20 times and increasing to 30 repetitions as you feel able. If you cannot do all the exercises in one go, take short rests in between. Hold the stretches in this programme for between 15 to 30 seconds and repeat 3 to 4 times. Speak to your physiotherapist if you have any questions. Lying on your back with both knees bent and hands by your side. Slowly lift your bottom and lower back off the bed, squeezing your glutes as you do so. Hold for 5 seconds, then slowly lower back down and rest before repeating. Really good, well done. Start sitting down with your bottom towards the edge of a chair. Place the feet hip width apart and arms across your chest. Lean forwards and stand up without using your hands if possible. Slowly lower yourself back down to a seated position by bending the knees. And again, up you go. Try not to drop too heavily onto the chair, control the descent. If this is too difficult, you can use the hands to help push you up. Place a resistance band around the ankles under tension. Stand straight, holding onto a chair for support. Move the operated leg out to the side and back in. Your foot should lift off the floor as you move it outwards. Rest your foot back on the floor before you repeat the exercise. Perfect. Does that feel okay? Place a resistance band around the ankles. Stand straight, holding onto a chair for support. Move the operated leg backwards, keeping the knee straight as you do so. Move the leg back to the start position, resting the foot on the floor before you repeat. Stand by your stairs or a step. Place the operated leg on the step, followed by your other leg. Step back down, leading with your non-operated leg first. This will feel challenging to begin with, but will improve with time. Try to do this without holding on if possible. However, if you feel unbalanced, hold your banister or wall for stability. Perfect. Standing on a step, hold onto a rail for support if needed. Leaving your operated leg on the step, step down with the non-operated leg, touching your heel off the floor. Complete this exercise slowly and controlled. Return to the starting position to repeat the exercise. And up. Perfect. Stand holding the back of a chair or kitchen counter. Move your feet out so they are about hip width apart. Bend your knees and stick your bottom back as though you were lowering into a chair. Return to the starting position before repeating. If you would like to book an appointment with the physiotherapist here to support you with this programme, please contact us at outpatientphysio@matterprivate.ie.